A lot of children and adults have airway issues, breathing problems that are impacting their sleep quality. All sleep labs might be scoring sleep studies differently, and they don't need to follow the American Academy of Sleep Medicine rules and guidelines. It's crazy to me. Labs can just have free will to do whatever they want in terms of the scoring.
There are a lack of normative data on pediatric sleep in general. You just have to take those results with a grain of salt and look and say, this isn't the end all be all. If you trust those numbers and don't look at the signs and symptoms of your patient, you can miss this.
There's so many different guidelines as to what labs are using, how they're scoring it, when they're waking the patient up. These are things we don't even ask about. So we really need to educate our families that we're working with.
If it comes back they don't have an AHI of 1 or greater in the case of a child, it doesn't mean they're okay. A child does not need a diagnosis of OSA to have an airway problem.
We know AHI and having apnea is end-stage disease, but simply mouth breathing, even if it's only open mouth breathing when you're sleeping, is a problem. And if we're just saying, oh, it's AHI, and if you don't have apnea, then you're fine, then they're missing a huge percentage of people that could be helped who are developing into a more severe problem.
Or you might have apnea of 9 seconds.
Right.
Or not miss 2 successive breaths. Or go to a sleep lab where they wake you up at 4 a.m. before you're in deep REM sleep, right? These are the types of things that literally make my head want to explode, because how can such smart people, like a group of orthodontists that are highly, highly educated, be so ignorant to these facts?
The patient came with the airway problem, but you didn't do anything to help it.
Yep.
And potentially made it worse. They might even agree or admit the palate's narrow, but the teeth are lined up. That's all that matters.
Yes.
So it's not that they're not even seeing the palate's narrow. They're just looking from the perspective of the teeth.
Right. That's what McNamara was talking about in that article in 2000, where he said this is happening all the time. We're just not looking at it because we're hyper-focused on the way the teeth fit. Your orthodontist should be the quarterback of these issues. You have a child who is snoring, and you have a physician or a dentist tell you it's fine, and you don't need to do anything about it. Find another physician or dentist.